If you have certain medical conditions that require your blood to be thinner, your doctor may prescribe a type of medication called an anticoagulant. Anticoagulants can prevent clots from forming in your blood. There are several different options for your anticoagulation therapy. The most commonly used medication is called Coumadin, warfarin. There are three newer alternatives to warfarin called non-warfarin oral anticoagulants, or NOACs. These alternatives are Eliquis, apixaban, Pradaxa, dabigatran, and Xarelto, rivaroxaban. It is important for patients to know what makes each of these medications unique when they work with their doctor to pick the best therapy. Warfarin and the new anticoagulants work similarly by thinning blood to prevent harmful clots from forming in patients with certain conditions such as atrial fibrillation or deep vein thrombosis. However, there are several differences between warfarin and these alternative therapies. Compared to warfarin, the new anticoagulants have several benefits. These include no need for regular blood monitoring and consequent dose adjustments, no diet restrictions, and fewer drug interactions. However, there are other factors to consider, such as there are no medicines that can be given to reverse the new anticoagulants. For example, if a patient is taking warfarin and admitted to the hospital for a bleed, vitamin K can be given to reverse the action of warfarin. However, there is no antidote or reversal agent for the new anticoagulants. New anticoagulants also tend to cost more money for patients, and lastly, no routine monitoring means that there is no way to tell if your blood is too thin. All three of these warfarin alternatives reduce clotting within a few hours after being ingested and begin to wear off after 24 hours for most patients. Because the effect wears off much sooner than that of warfarin, it is important to take the correct dose every day to reduce the risk of harmful clots or bleeding. Unlike warfarin, on the new anticoagulants, your doctor will prescribe a set dose that you should take every day. Eliquis should be taken once in the morning and once in the evening, at the same time every day. Pradaxa should be taken once in the morning and once in the evening with a full glass of water. In addition, Pradaxa cannot be crushed and must be kept in the original packaging. It should not be placed in a pill box. Xarelto is usually taken once a day. The 20 mg and 15 mg pill should be taken with the largest meal of the day, typically dinner, while the 10 mg pill can be taken with or without food. It is important to remember for all of these warfarin alternatives, dosing varies for each patient and should be taken as prescribed by your physician. While on new anticoagulants, maintaining a healthy lifestyle is very important. You can eat all types of food while on these new anticoagulants. Drinking alcohol or smoking tobacco products, including medical marijuana, can increase your risk of bleeding or clotting. The best way to reduce your risk of bleeding or clotting is to avoid alcohol and smoking. If you must drink, do not exceed 1 or 2 drinks per day. Physical activities such as walking, jogging, swimming, and gardening are usually safe and should be continued. Activities that place you at risk for injury should be avoided, as these medications increase your risk for bleeding. It is best to check with your healthcare provider if you are unaware which activities are safe for you. As with warfarin, these new anticoagulants can increase your risk of bleeding. These bleeds can range from a small nosebleed or bleeding gums to a serious bleed in the brain. Warning signs of serious bleeding can consist of bloody stool or urine, coughing or vomiting blood, unusual bruising, severe headache, difficulty with speech, numbness or weakness in an extremity, or changes in vision. Insufficient anticoagulation can lead to clotting, which can cause shortness of breath, chest pain, redness or swelling in any limb. A clot can also lead to a stroke causing dizziness, vision changes, numbness or weakness, or difficulty speaking. You should contact your provider immediately if you experience any of these symptoms of clotting or have serious bleeding. It is also important to contact your provider with changes in medications or dietary supplements, as these can interact with your anticoagulation. Also notify your provider of any planned procedures or surgeries, as these may require you to temporarily stop your anticoagulant. Make sure to update your provider with changes in contact information or to request refills for your anticoagulants. Finally, if you ever have any questions about your anticoagulation treatment, do not hesitate to contact your provider. For more information about your anticoagulation therapy, feel free to visit anticoagulationtoolkit.org.